grateful to be part of this Care and Cure family as a previously funded epilepsy fellow and to be here today to show you how your support helped me bring me here. As a LA native born at California Hospital near downtown to parents who were initially from Korea, this is particularly meaningful. My interest in neurosciences began as a Columbia undergraduate in New York City and created a foundation and my commitment to the workings of the brain. After I finished medical school in DC, I returned back home to LA and I saw my first patients as a doctor and pediatric neurologist in training supported by Care and Cure at Children's Hospital LA in Silver Lake, serving a community just a few miles from where I myself had been born. The first time you see an infant seizing, whether as a caregiver, parent, or physician in training, time stops, as Kelly mentioned, and it's an emergency. The loss of alertness and awareness, the loss of physical control, it reframes what's urgent and really important. It's a call to action and reframes reality. Sometimes these seizures start on the first day of life, hours after birth, consisting of uncontrolled jerking and stiffening. It can take so many forms. Other seizures can be more subtle and consist of slight but recurrent head drops, which can appear benign but belie a chaotic brain rhythm underneath the surface. A really recognizable epilepsy syndrome to the trained and discerning eye, which should be treated emergently with expertise. Many of those infants and children with early onset seizures can have no family history of seizures. It can be due to a de novo or of new genetic variant that can be associated with uncontrolled seizures that persist daily despite multiple medications, neuromodulation, epilepsy surgery, diet therapy. These children often have significant developmental needs and are often nonverbal, non-ambulatory. These kids have a higher risk of hospital complications, morbidity, and mortality. And so these seizing children really push us to jump into action and continues to motivate me to create more access to diagnostics and precision therapeutics, such as our current antisense oligonucleotide or ASO research for complex epilepsy, some of which we just showed you today. We really need to continue to band together for causes that matter and that impact any one of us, and to forge pathways forward and deliver optimized cutting-edge care for every person out there with epilepsy. Really, the uncertainty and hope for safety for our children on many levels calls for unity and urgency, and I really thank you so much for your support. I'm so grateful to be part of the Care and Cure legacy, and this is really just the beginning, and there's just so much for all of us to do together. Thank you.